Good morning, everybody. It's our pleasure to be here with Larry Bramlage and Wayne McIlwraith to have them give some opinions on the state of the injury and help us work our way through some tough questions. Good morning, you guys.
Morning.
Morning.
So I think let's start with you guys giving us your opinion on where we're at with the injuries or the cluster injuries that have occurred in California and the topics you think that we should cover around that.
Okay. Well, only because I'm more in California, I think we'll, the obvious thing is we had this cluster and then some people came up with quick conclusions. There's a combination of factors, as been stated before. Racetrack surface. So first of all, we'll come back to racetrack surface, but racetrack surface, an incentive, or the horsemen received notice, for instance, that if they didn't have enough starters, that they wouldn't get the stalls, or their stalls would be allocated on the basis of horses they had in, which I think is a factor in pushing horses out onto the racetrack. Medication, of course, always exists, but there's no quick solution. And also soundness, or the perception of unsoundness. Were there unsound horses starting? That's always addressed, and I think we should talk about that as well.
There's a couple of facts that we have to keep in mind, and that is the national injury rate for thoroughbred racehorses has been gradually declining over the last few years. Now, nothing lasts forever, and you're always going to have variations, increases at some times and decreases at some times. And these little episodes happen every once in a while. There was one this year at Santa Anita. 6 years ago, it was at Aqueduct. And so you get a little group of injuries that result from factors coalescing all at the same time. And certainly weather and track surface played a role in both of those incidents, where the winter weather in New York and that huge rainy month in California, that sets up things. But background injuries are a fact of high-level athletic competition. In fact, one of the things that has the most effect on a football team having a good season is how many of the 22 starters that start the first game are still playing on the last game, because some years teams have virtually no injuries and they almost always have a good season. But if they have a real large group of injuries, higher than normal, well, then their season is bad, because that little group of injuries hit them that year. And I think that's what we see in the racehorses, are these little episodes of increase in injury over the background rate. The background rate is 16/100%, which is pretty small, but at Santa Anita you got 3,000 horses training, and so one of those, if you put one of those little groups into that many horses for the factors that Wayne said, you get a jump, and that's not an excuse for it being okay, because we have to look at it. It actually may show us some things that we need to know, but it's a fact of life.
Well, thanks for putting that in perspective, and I think that historical perspective is good. Wayne, being out there, do you have an opinion? Maybe it's too early to tell about surface weather, the other things that might have led to this particular set of cluster injuries?
Well, certainly weather and surface combined. As Mick Peterson and I pointed out in that editorial we wrote in the TDN, we had a lot of rain, a lot of bad weather. The track was sealed, and when you seal the track, you compound the factors because you change the way the track is. The important thing is with track maintenance is that it changes all the time. You've got to have regular testing. That's why Mick and I started the racetrack testing laboratory, where people could put samples in. But something that Larry brought up is really critical, the weather associated with that. You see an extreme variation in correlation with the weather. What we've found is that consistency is primarily associated with moisture content. and the moisture content changes how it is for those horses to train on. You know, I think that in retrospect, hindsight, certainly there were days that rather than sealing the track, they should have closed the track, because it's really impossible to emulate a good racetrack when you're just completely soaking. And so that's an important factor. Testing needs to be done regularly. Maintenance, good track maintenance costs money, and there's certainly a financial factor in that. But no, sealed racetracks will increase injury. And I don't think anybody questions that. The big dilemma is, of course, when do you decide that you should close that track? But if you have good track maintenance and the track superintendent is allowed to do their job, that assessment should be made by him, not by the racing secretary.
So if I'm hearing you right, it sounds like you feel pretty comfortable that you're able to evaluate the track and know what it's like. There's things in place to be able to fix those problems when they're identified. It's really knowing when to call it and getting buy-in.
Absolutely. You know, I think Mick Peterson, for instance, has always said he can make a dirt track as safe as a synthetic track. There's no question that if we had a synthetic track in that weather pattern at Santa Anita, there would have been less injuries because you can drain them. But on the other hand, there's two factors when you're looking at tracks, and these techniques are being developed. There's assessment of the surface with various techniques that can be done very quickly, and then there's Doppler radar for the base. And so there's a lot of technical knowledge now available to monitor that. And I think that that's particularly important in this case. As I said, you know, the decisions aren't always made by the experts.
Thanks. Larry, so you gave us some historical perspective there. Was maybe giving a little bit more clout for the track superintendents in those other cases? Would they may have decreased the injury rate historically? Do we have lessons learned that we can pass along to California?
Well, the extrinsic factors from like weather influencing the surface are more a situation of changing what the horse is used to. And so you may, rather than the horse being able to stay on its comfortable surface the whole time, inconsistency is the thing that bothers the horse the most. It's sort of like if you go out and go for a run, you can run on asphalt or you can run on grass, but you never run just outside the curb where you have to go over driveways and grass and differing surfaces. And what the weather does is tends to change the consistency of the racetrack. So a horse going along used to one surface hits a different kind of surface, and then the biomechanics change and the horse's loading of his limbs change. And that may bring up one of the intrinsic factors which involve the horse.
I know another thing that's going to be on everyone's mind is the medication. So we've been able to get a few questions from other racetrack practitioners, some of which are past AEP presidents. We'd like to read a few of those and have you guys respond. One of them is, how will the unilateral change in medication reform affect the UMP and uniformity?
Well, you want me to? Uniform medication policy has been something we've been striving for 30 years. In fact, maybe 50 years, because that was the topic number one in 1954 when the AAP was founded, was racetrack medication. Uniform medication is something that we need, but we've been working for a long time and haven't been able to get there. One of the reasons is each individual jurisdiction wants to tailor it for their own needs. And so you take a uniform medication policy, and Kentucky may look at it and say, we like it all except for this thing. We're not going to adopt that, and California doesn't adopt one other, and New York has a different opinion, the Mid-Atlantic tracks. All of those change something, and pretty soon you're back to square one. You have no uniformity at all. So I think if we're going to have a uniform policy of medication, everyone's not going to get everything that they want. but we need to go in or try to get to a place where everyone gets something they can live with.
To add to that, like we had a racing summit in December 2000, which is obviously nearly 19 years ago or 18 and a half years ago. And the AAP initiated that, and then they had stakeholders from all aspects of the industry, regulators, veterinarians, trainers, and associations. And from that was formed the Racing Medication Testing Consortium, which started in 2001. The number one goal of that was to get uniformity between states, and so 18 years later we haven't achieved it. And I think that, as Larry said, we both agree that we have to have that to move forward. And obviously the RMTC hasn't been able to. That's not a criticism of the RMTC, but you've got certain stakeholders there, and they go back, and it just can't happen because of the reasons Larry pointed out, individual needs, individual preferences. So we do need a national authority. I think not everybody's resisted, but some major segments have resisted that, but that's what we need.
So it seems like I'm hearing that you agree that uniformity needs to happen. People have been trying it for a long time. We haven't been able to get there. So are we in a climate today? Have the changes in what the public is thinking, is that enough to get us there? Or how do we reach this unobtainable goal that's been sitting around for many years?
Well, I think we are in somewhat of a crisis. We're sitting on the edge of a cliff, and it might take only one more bad episode to precipitate things that make racing tenuous as far as its survival. So I think this is a situation where it drives us towards where we need to go, and everybody agrees that we need to go there, but nobody has been willing to give up anything at any point. And so, the uniform medication situation all hovers around the controversy with Lasix. That comes up first, and you never get past it. I really believe we could reach agreement on all other subjects if we could get through that one.
Yeah, well, and I think we'll hit Lasix for sure. So we don't have a big enough hammer, or we haven't historically, to drive this nail down. Are we saying that maybe it's the general public's view of race day and new medication reform that may be the thing that brings it home? Or do we have an opinion on how we're going to get there?
The general public, I don't think, understands the issue nor cares about it. The general public cares about racing fatalities, and they care about medication because this day and age, that's perceived as drugs, and nobody's for drugs. And so they believe that those two issues are more intertwined than they actually are. And so the knee-jerk reaction to some of the people to the spate of injuries has centered on handling public perception as opposed to handling the real issue that's going on. Now, I don't want to downplay that, because that's important. If the public decides that we are no longer relevant, we're vulnerable. And politically, we couldn't resist that. So we have to be aware of that kind of perception, and we have to do something that gives the general public a confidence in the fact that we're doing all we can in order to minimize the risk to the horses.
I agree. We've been in numerous discussions, both of us, at various times on Lasix, and as you know, you participated in one in California. And the critical thing is the argument for the get rid of Lasix is perception, is that against worrying about the Lasix issue is that it's all about fatal injury. That's what turns people off. That's what got everybody upset in California recently. The question of eliminating race day Lasix, there's some laudable reasons to do so because we're out of step with the rest of the world. Certainly the associations in the US that are perceptive of international regulation want it to go away. But the argument that it's race day Lasix or race day medication is what turns the public off, they don't care. What they care about is that fatal injury, the catastrophic injury.
I think it's not the medication Lasix that's the problem. It's the fact that it's given on race day, as Wayne alluded to. And that's the thing that journalists who are writing about the subject always come back to. And it's the controversy that kills us. No one really argues with the fact that Lasix is effective at reducing bleeding. That's pretty much a generally accepted topic. There are variations of allegiance to the drug Lasix, but most people agree that it does help the problem. The trouble is giving something on race day is just not palatable for the rest of the world or for the general public. So we need to find a way to get around this situation, and it takes the wisdom of Solomon trying to find that.
So is there anything in today's climate that's going to move the needle?
Fear. Yeah, I mean, the only way we will have anything happen is the fact that the two camps are so entrenched that I don't think you can mediate them into an agreement. You're going to have to petrify them into an agreement for fear of their own livelihood. And we may be in a situation where we're reaching that area.
I think we're close. Totally agree.
Any other comments that you guys want to make? We've kind of jumped into the Lasix question. What's the industry going to look like if we have uniformity or we have the loss of race day Lasix? How's that going to change the landscape as it exists today, for the good or for the bad? How do you guys see that?
It'll be forgotten in 6 months.
Yeah, I mean, there'll still be a winner in every race. I think that it's a question of how you want to attack the underlying problem of the fact that horses that are in high-level athletic activity are vulnerable to pulmonary hemorrhage, and whether that's acceptable or not acceptable, or whether we are able to tolerate that occasional occurrence or the underlying occurrence that affects performance. If everybody's on the same playing field, wherever we're at, which is we're all on the same playing field now because almost every horse gets Lasix. And so if every horse didn't get Lasix, you would lose some horses, there's no doubt about it. But it's going to be much fewer than I think most people perceive, but the performance of a lot of horses is going to be affected.
You know, there's enough experience internationally in every other country where Lasix is not allowed that we know that decrease will be relatively small. You know, we get good European horses that bleed coming over and racing in the US, but it's not our biggest issue.
You know, we're spending a lot of time on the extrinsic factors, you know, medication and surface. And there are some areas inside the horse that we also need to look at. And that's a lot of what's going on at California right now with the regulatory veterinarians knowing which horses are going to breeze and taking a look at those horses to see for sure that they're sound, similar to what they do before races. There's another change that I really think we need to make. This is one that we could make without too much trouble, and I believe it would have an effect. The equine injury database shows that a horse that goes on the vet's list, which means has been observed to be lame at some point by a regulatory veterinarian, whether it's coming off of a race or scratched before a race, if they go on the veterinarian's list 3 times, they're almost certainly to have a fatal injury. And the reason that is because they're not being diagnosed. Going on the vet's list doesn't mean that somebody's made a diagnosis on the horse. It means that they've observed that they have been lame. But yet a lot of those horses get time, they get palliative medication, they might get physical therapy, they get sound. They have to work then before they race, but when they go back into high-speed activity, they get lame again. And that gets them on the list the second time. And they still may not get a veterinary examination. So I think if we could make one change, we should require a horse that goes on the vet's list to have a veterinary examination or they're out for 90 days. Because we can't tolerate this increased risk that we're not eliminating where we could.
So I think if I'm hearing you right, and I think you both said it, really it may not be the specific medication. We really need to address fatality, and it may not be the medications playing into that.
I absolutely think that's true. I mean, I think the medication has some influence in that there are things that you can do that reduce the level of lameness, but may not eliminate the predisposition. And we've made strides in that, you know, the changes in corticosteroid medication rules, that's a big one that allows us to keep a better handle on where the horse is. But we have to also pay attention to the fact that horses that are showing a problem need to be diagnosed, and we could do better there.
That's some great insight. In fact, it plays into one of our questions, which was, if you could implement one rule that would have the single biggest impact on decreasing fatalities, what would it be? I think you gave us your answer, Larry. Wayne, what would be your answer to that?
No, mine would be the same, more thorough examination. There's a lot of variation between barns, trainers, vets, as to how detailed an examination is regularly done on horses. You know, I know one trainer that I do surgery for, as soon as something's not right, that horse goes out. You know, it gets lay up, but it also gets definitive diagnosis before it goes. Whereas others, there's denial, often because of various reasons, not their fault. They don't get looked at sufficiently. So it'd be a uniform diagnostic level where these horses get thoroughly examined regularly. And I'm not talking about going into a bone scan or that kind of thing, but jogging up for the vet. Because sometimes it's ignored by various parties. But if the horse doesn't come out regularly, come out of the stall and have a veterinarian look at it, and it's jogged and assessed, that can be problems. Now, there's various levels of care that go on as far as assessing those joints carefully. I know trainers who assess those limbs every day, others that don't. But I'm not picking on trainers there. It's a group effort. And I think that would save a lot of things. That's just really further to what Larry was saying. Because I'm sure we'll get into it, because it's not a elimination of medication within 14 days is not the whole solution. And so sometimes these joints need help, but there's different levels of medication that can be used.
So if we dive into the pragmatics of what you guys are suggesting, it's really we need to have maybe an unbiased party evaluating these horses. If we use the example, 3 strikes, you're out for some time, who's going to apply that? I get the feeling that, you know, there's concern if we put that in the hands of the regulatory veterinarians, they can sometimes get criticized that they don't get to see that particular horse all the time and they don't know it well enough. I mean, how do we actually implement that?
Precisely. I take out the unbiased adjective you used, because I'm not talking about regulatory veterinarians having a greater role, and I think Larry's the same. What we're talking about is when that horse is identified by a regulatory veterinarian, that it gets thoroughly assessed by the trainer's veterinarian. I'm talking about diagnostics by the trainer's veterinarian, because he or she knows the history, or they can get the history as far as that's concerned. No, that's really critical. And to add to that, it doesn't mean, I'm also not suggesting that we just have that level of diagnostics when the horse is on the vet's list. It needs to be a regular event.
I think if you put in the rule that if you go on the vet's list, you have to have either a lameness examination within a week or you're on the shelf for 90 days, it protects the regulatory veterinarian. Because right now, we're depending upon the regulatory veterinarians to pick out the at-risk horses with a situation where they don't always get the biggest help from the trainer. There's this perception sometimes that we don't have diagnostic equipment that can identify the kind of injury that predisposes a horse to a fatality. More times than not, it's not that we can't identify it, it's that we're not looking. And there are certainly trainers, as Wayne said, that are really in tune to the fact that when something starts showing up on a horse, you need to find out what the physical issue that underlies that is. And so I think it's not a matter of we don't have the right diagnostic tools, we don't have the right diagnostic mentality. We have to continually move towards the fact that when a horse is showing something's bothering him, you need to get to the bottom of it. They can't talk, so they need a lameness exam. And we have tools that we could use, but we still don't use them at a level that would be ideal.
So, Larry, I want to turn back to something you alluded to early on when we started today, was the different groups have a perception of different needs, and that's what's really maybe impeded a uniform medication. What if we look at it differently? Do you think that all breeds should have the same medication rule, or should it be specific to thoroughbreds?
Well, the thoroughbreds have the equine injury database, which gives us a good handle. And that's a laudable endeavor that was started out of the Welfare and Safety Summit that Mary Scalay actually is most responsible for. And so we have a pretty good handle on some of the predispositions that cause a thoroughbred to be at risk for a fatal injury. Now, other breeds' risk profile is going to be different. And so I think we have to look at whether that risk profile applies to this with the same kind of importance to other breeds that it does with thoroughbreds before we make a statement as to they should or should not have all the same regulations.
Yeah, it's a good point. Using the example of California and the 14-day stand-down rule being instituted, there hasn't been much hue and cry from the vets regarding that. They can cope. On the other hand, you've got to look at the different training. In other words, they're out there training every day or more or less every day. Cyclic trauma causes a lot of microscopic damage, as you know better than most, and there's wear and tear. But if you look at the quarter horses over at Los Alamitos in California, they train differently, they get fit, they have a lot less cyclic trauma. And the business model for quarter horse racing, it won't fit with a 14-day stand down because you have the futurities. Generally, you have your futurity trials. 2 weeks later, you have the final. Those horses need to be examined and treated appropriately if they need treatment within 14 days. Everybody, including the quarter horses, in my experience, and I'll get Larry to specifically talk about standard breds, but when it was 7 days after, the AAP set up a policy and we recognized the threshold levels, they were gained by the labs, and we went and that was pretty acceptable. Initially they were worried, but it's worked fine for the veterinarians working on top-level quarter horses, racing quarter horses. But 14 days makes it hard, so you'd have to change everything because, owners make futurity payments, the calendar's set, Are we going to go to 3 weeks between trials and final? It's not a one-size-fits-all thing. Plus, the pattern of catastrophic injury is quite different with racing quarter horses than it is with racing thoroughbreds, and what we do surgery on.
So it sounds like there may be an agreement that the different breeds may need to be looked at as separate entities. Is that what we're hearing?
Well, under some situations, I mean, like, I don't think for a medication or a drug like cobalt, which is meant to improve the performance of the horse, you make any difference between any breed, because that should be illegal no matter what breed it is. But risk profiles as far as the individual injuries, standardbreds go every week. They race every week whenever they're in the heavy season. And so they have a different risk profile. They don't have the catastrophic injury risk that thoroughbreds have, because they have 2 feet on the ground at all times, you know, so whether they're pacing or trotting. So there are certain aspects of the regulation that probably should have variations between breeds, but there are certain aspects that should not be allowable no matter who it is that's racing in whatever race it is.
Now, when I'm talking about medication within those 14 days or the need for it, the perceived need for it, it's based on a diagnosis and, you know, therapeutic indication. So we're talking therapeutic indication. It's good that Larry brought up the cobalt thing, because we're never talking about inappropriate performance-enhancing medication.
So Wayne, I heard something, and I just want to circle back and clarify on it, because what I heard was it's really, you know, we've got a 14-day rule, and it's not conducive for the business model that has preceded it. So, you know, there's probably some that would criticize that. Can you say what you think's best for the horse, if that's our guiding light?
Oh yeah, and I've already had discussions on this with people that are not associated with. No, it's an either or. It's not an impossible one. And so first of all, addressing the pragmatics, you know. The main thing I was saying, that if we are going to have a 14-day stand-down rule and it's one size fits all and it's needed in quarter horse racing, then we'd have to change the model, as I said, you know, trials, because it's very appropriate for the vet to come after a horse is qualified for a final, and there's a lot at stake here, that, you know, the vet comes and does a thorough examination, injects appropriately. No, the injections have not always been given appropriately. Sometimes it's routine injection of multiple joints to make sure that the horse breaks. I'm staying with quarter horses at this stage. So you can make a pragmatic change, but it's going to be astronomical as far as the effect it'll have on people investing in racing and looking after those horses that are well bred. Will they carry on? Don't know. But on the other side of the coin, as I've already implied, it's different. You know, like, I think that there's plenty of argument that can be given. If we're talking specific medications, intra-articular corticosteroids, is that necessary within 14 days for a racing thoroughbred, where there's a lot more options for races and you can make the schedule a lot more easily? Whereas if you take quarter horses, the big races like the All-American Futurity, the Los Alamitos 2 Million, these grade 1 $1 million races, they're already set in the calendar, and it's going to take quite a big change to do it. But on the other hand, I think I can justify selective use of corticosteroids within the 7 to 14 day period, preferably more towards the 14-day ahead, for horses that are not out there galloping on those on the track every day. And if you've got a synovitis, inflammation in the joint, you can settle that down. Everybody's happier. The horse is happier. The horse is less likely to have a problem because he's got complete weight bearing. his proprioception is good, and so I think there's arguments for it to be different. I think saying that everybody should be the same is naive.
Any comments on that there?
Well, I think the one thing you have to always keep in mind is we have to make the regulatory veterinarian's job as easy as we practically can in order to protect us. I mean, their job is to protect the horse, which protects us, which keeps the general public in a better position as far as their regard to racing. So the one thing that is a continual discussion is should non-steroidal anti-inflammatories be allowed within 24 hours or 48 hours of the race, because there's different stand-down times in different racing jurisdictions, and I think the AAP came out in favor of 48-hour stand-downs, and that absolutely is appropriate, because the regulatory veterinarians are looking at the horses the morning of the race, and if they've had recent non-steroidals, they may not see the true horse. We need to be sure that they're able to see the horse in the condition that it's going to go to the post. And so I think 48-hour stand-down times for non-steroidals probably should be something that we could get to, and we should get to quickly. It's one of those things that reduces the inherent risk, the intrinsic risk to the horse.
I totally agree. And I think that, and the point is that vet exam, like obviously the 14-day stand down with corticosteroids is directed not just to that, but certainly directed to the regulatory veterinarian being able to look at a horse without any effective anti-inflammatory medication in it. And so going back to the issue of the 14 days, it's just because the model is the horse is going to race 14 days after it gets in the trial. But something else that I've just thought of, there's only 10 horses going to be in that final. And so you could make it very restrictive. In other words, the day after, within 2 days, the vet's got to go over that horse and treat it, so that you've got a window. This is just, I'm just suggesting this, but a window of, say, 12 days where you can shut it down. It's just that right at 14 days makes it impossible for that horse to be treated at all.
Wayne, just coming off the grand opening of a building that's focused on biologics and things of that nature, as we look at biologics, should they be subject to the same 14-day stand down as other intra-articular administrations? What's your thoughts there?
I don't think, well, I think we need to be specific, but say we just use the example of autologous conditioned serum, IRAP, orthokine, the various names that it has. I don't think so, because as I mentioned before, we all know that racing causes, synovitis, inflammation in the joint, is a big issue. A lot of these horses need treatment. I think in the case of autologous conditioned serum, based on the research we've done at CSU, there's no harmful side effects. There's no risk of cartilage deterioration from the medication. And the pragmatics are that its use has increased in Europe as restrictions on corticosteroids got better. And I think that's a good thing. If you equate, injecting IRAP with injecting corticosteroids, totally different situation. And I think it's not going to have the dramatic direct anti-inflammatory effect, but if it's a regularly scheduled medication, like Larry was talking about this when we were discussing IRAP yesterday, in that often he sees the best improvement after the second injection. And as you know, it's made to be given a series of sequential injections, and I think it's very therapeutic. Now, I know therapeutic's an adjective that gets used and misused, but I think it is therapeutic. There's other pragmatics. Basically, you can't test for it. We all know that, and you've got to be able to test for it, but I don't think that's harmful. But they need to be validated treatments that have had selective work that they don't cause any harm. Like, for instance, in IRAP, we know that it doesn't cause any change to the articular cartilage.
If we take a little deeper dive on your example of those biologics, and specifically IRAP and the use in Europe, is it safe to say, or did I hear you imply that they've been doing it and we haven't seen a change in their fatality or morbidity, somewhat speaking to the safety of it? Or can you maybe address that a little bit more specifically?
Well, I haven't got proof of I know that they're being used more. Like if you look at the relative use of a biologic treatment such as IRAP compared to corticosteroid, it's skewed quite differently than the US. Now, have we proven that there's less injury or whatever? No, we don't have that information because they don't have the equine injury database like we do in the US. Certainly there's a lot of variation that Larry talked about, having spots where you get an increased injury rate. And of course, there's a lot of national hunt racing. You know, you need to have specific comparisons with flat racing horses versus national hunt. But we've got those data are also obtainable in the UK, for instance. And so it's a good question. I think it's something that, if it could be monitored, where you have declaration of those medications, it's something that we could eventually answer. You know, as you know, we're in the early days of biologic therapies, but what I'm saying is that there is increased use now, but you got to be careful using it as an argument that it's better than, say, corticosteroids. I realize that.
This is a situation where we're a prisoner of our own society. The regulations for corticosteroids, for example, in the United States are quite different than they are in Europe, while the practicality of use is not that much different. For example, if you're going to monitor or enforce legally a medication in the United States, you almost have to have solid levels of detection, whereas I'll give you an example. In Europe, at 14 days, you can inject multiple joints in the horse as long as you go on record and file that you've done it. And whenever it comes up in the post-race testing, it's compatible with what you said that you did. Whereas in the United States, at 14 days, if you inject multiple joints in a horse, you may get set down, you may be fined, you may lose the purse, because we're only focused on the levels. Now, I don't know how we get around that, but there must be some sort of intermediate where we declare that we've done something and someone can rule on that it's okay, that it's within the parameters of good veterinary medicine and doesn't put the horse at risk. Now, you know, the thing about corticosteroids, why they're the bellwether, is that they actually can, if given close enough to a horse, mask a symptom that might be dangerous. And I don't think most of the biologics, from what we know now, would fit into that category. So if we were able to agree and write regulations that were appropriate for those medications and not try to regulate them the same as corticosteroids, they probably are a much better alternative.
So if I'm hearing you guys right, at the very minimum, you think there likely should be different rules for the biologics and some of the other small molecules.
From what we know now, I would say that's the truth. And
certainly in comparison to corticosteroids.
And I think you might have to go individual by individual, because pretty soon there might be a biologic that throws the whole thing off level. So you're probably going to have to go medication by medication whenever you write those.
A good example of that is the future. Yeah, you can't just tar everybody with the same brush, because, for instance, the British Horse Racing Authority have just committed £1 million over 5 years for looking at gene doping. There's a lot of perception out there that gene doping is the next level of egregiousness, and they admit that there's nothing happened yet. You know, we've talked to Rick Arthur about it, both of us, and you know, we've got experience with gene therapy. I think we know the potential or the lack of potential, but it's going to be on the radar, and then that's going to be a totally different situation. If you can get long-term change in the joint, it all gets down to performance enhancement as well.
Well, it sounds like, you know, Larry's suggesting that maybe the pendulum's swung a little bit too far. We're looking at raw numbers coming out as far as level, and we maybe need to bring back a little subjectivity and put the person back in. But
well, I want to clarify here. I think the changes we made in corticosteroids were good for the horse, and they're good for racing. They are a more medical-based approach to the scenario. Our problem only is with enforcement. In our litigious society, it's altogether different than the British Horse Racing Authority. They can set somebody down and virtually they don't have any other alternative, whereas if that happens in the United States, it has to go through the local court and the appellate courts in order to actually enforce our regulations. And that has somewhat to do with our lack of central authority that can do that thing, and only the state can do it in the United States.
It's a really important point. You know, you don't have attorneys and defenses and appeals, whereas I was involved as a witness in a high-profile case in England some years ago, and no, there's no appeals, there's no lawyer defense. Basically, they have complete authority, and I think, I'm not saying no rights, but we certainly need stronger authority. But if you're going to have that, you've got to have absolutely accurate testing. And, you know, going back to the uniformity thing, there's a lot of variation depending on what testing lab is used. And it's money and the degree of testing.
well, talking about decisions being made, let's take a turn to possibly a little bit lighter subject in the Kentucky Derby and maximum security. I'm pretty sure that the people watching this are really going to want to know what your thoughts are on the DQ in that race.
You start.
That's a hard one.
Yeah.
This is a situation that it has several levels of question. Now, if the number, I'm going to use the horse's numbers because it's easier. If the number 7 horse moved in front of the number 1 horse and interfered with him, and also Asmussen's horse, the other horse that got interfered with, and those jockeys filed the objection, and that resulted in a disqualification. The thing I don't really think was right about that scenario is one of the objections was filed by a jockey who was not interfered with. His horse wasn't significantly bothered, yet the whole ruling was most beneficial to him. And so I'm not a steward. I wouldn't want to be a steward, and they were in a tough position. But what wasn't really clear is the fact that that objection was the one, at least that was announced at the track, and I guess there was another later objection as well. But to file an objection and get your horse moved up when you were not really interfered with, that doesn't sit well with me. So it has to come down to the ruling on the horses that were directly hit in the incident and whether that affected their eventual placement. It's interesting that in Europe, they probably wouldn't have changed the order of placement, where in the United States, because we're so litigious, our rules are so much more defined that put that at risk of happening.
I agree. You know, I watched it a lot. You know, we all watched it on replay when we were in front of our television sets. Larry was there, but yeah, there was a horse that definitely had to sort of hold up some. But that jockey never submitted a protest, and it's been confirmed in interviews that he didn't. And I agree. I think the big issue is the fact that the protesting jockey, it's interesting. It's almost like, why did he do that in the first place? You know, so it's really unfortunate. I don't know, in the Kentucky Derby, when you got 20 horses, you're going to have some issues, and I didn't expect them to disqualify him, you know, just sitting there as an observer.
Well, wonderful. I want to take a moment and just thank you both for being thoughtful, providing us with your opinions, and I'm sure everyone that's watching or listening to it appreciates your viewpoints.